Hello and welcome to Traditional Chinese Medicine. This is Christina Kapothanasis. I am a Chinese medicine doctor and acupuncturist in beautiful Honolulu, Hawaii. I am a graduate of the Shanghai University of Traditional Chinese Medicine in Shanghai, China, where all my studies and residency were conducted entirely in Mandarin Chinese language. My mission is to help people integrate Chinese medicine into their daily lives to promote health and well-being. So if you think this video would benefit anyone, please share. I have an Instagram account, Chinese Medicine Hawaii, and I post what I eat every day on there to hopefully inspire others to eat healthier too. So please check that out if you have time. And I am working on, and have been working on, courses to include all of my food recommendations and lifestyle recommendations and every question and answer that every patient has asked me over the 10 years that I've been practicing here in Honolulu, and I'm trying to put it into a nice tidy course. So please check back for that course and hopefully more to follow on our website or in the description box. Today we are excited to continue our treatment with the patient from last week who has so many symptoms, it's hard to say her chief complaint, which is why I said stress-induced symptoms. And I was tickled to see her this morning, and I will report on her progress. Last time I didn't check her blood pressure, so today we were starting with a blood pressure of 140 over 105. And we will continue to monitor the progression of her blood pressure. I asked her, how did she do on her diet? And she said she has struggled with diet for most of her life, but what I heard about the past week is she was able to follow our diet with everything except the legume and bean family. She eats or ate beans or still eats them every single day. And we are trying to slowly take the beans out of her hands. She also has trouble eating a lot of meat, but I said you don't have to eat a lot. You just eat a little with your meals, and that's good enough. Animal protein. Otherwise, she was good at avoiding everything else I asked her to, and she felt heartburn after taking the herbs. So I recommended that she try the boiled herbs instead of the powder, because maybe she's allergic to the fillers. But she wanted to try the powder herbs one more time. And I'm all for that, because this time we are going to try to reduce some of her medications. And as you remember, her medication list is extremely long, so probably just no stomach can handle all of that. And maybe she'll be able to be okay after, since the formula I gave her was not a hard on your stomach formula, and only if she had an allergic reaction would she be having heartburn from that if it were the herbs. Later, after taking her pulses, I did figure out that she ate curry powder the last 2 days. And if you don't know, curry powder has chili pepper powder in it, or some kind of hot red pepper spice. So chili powder is not okay. And there we go. We learned our lesson, and she will avoid that because it upset her pulses, which I will go over with you in a minute. I asked her how she did on her symptoms. And I was really expecting her migraines that she had daily at a level, pain level 4 to 5, to go almost away. So when she reported the pain level and the daily consistency was the same, the only difference was she was happy to report instead of lasting 4 to 5 hours a day, they lasted 3 to 4 hours a day. And she still had to take her Phenergan for the nausea, vomiting, 4 times this week, which she can take as needed. So I felt a little puzzled by that one. And I continued to ask how did she do. Her itchiness, which she thinks is somehow related with the thyroid because it only started after they discovered she had thyroid imbalance, went from a level 6 to a level 4. I was hoping for more. And her sleep was the same. I didn't know if I expected her sleep to improve that quickly, but I just asked for the heck of it. And her stools, I definitely expected those to improve, and they did. From every 3 days, pebbles to formed, she went to every day formed. And Chinese medicine, you have your tripod of health, you have your bowel movement, your appetite, and your sleep. So if one of the legs of your tripod is broken, you fall over more easily, and she only has her appetite going for her now, her sleep, and her stools were bad, so now we put 2 legs back, and the only leg we have left for her foundation is her sleep, which will come. So I took her pulses, and I found that her left pulse was very slippery, and I was like, how did she get hotter? That doesn't make sense. She wasn't slippery in her overall pulses. Last week, her heart was 25%, whereas last week it was 50, and her kidney stayed 25%, and her liver was 25%, no. It was started out passing last time, but it went down to 25%. So this time at least it wasn't overactive starting. It was at a 35%, but it had an overactive quality to it. I repeat that. So last time it was 25% after the needles and calm, but this time it was 35% with an overactive feeling, so I knew that it would go down after I put the needles in. And it was some kind of inflammation, which I had to grill her about and figure out what she ate to make this happen. And then we pinpointed the curry powder, and I said, oh, that makes sense. Plus she's so sensitive, she cannot even handle a tiny bit of curry powder that she ate in the past 2 days. When I took her other pulse, then I confirmed my suspicion that it was a spicy, because her stomach spleen pulse was also pass and slightly overactive, so I knew that it was irritated, and her lung and her large intestine was 25%. So her tongue was still very pretty. And then we went back to the migraines, and I said, the migraines should have really gone away. And she came up with, offered this piece of information, which was of course very crucial to what we were going to plan next. She said that she was on trazodone previously, long time ago, and when she was taking it, she had headaches every day when she woke up. Then she stopped the trazodone, and for some reason, recently, I'm not sure how recently, but the doctor put her back on trazodone, even though she told the doctor that she suffers from headaches every morning when she wakes up with trazodone. So, we aren't going to make any progress if she's taking a medication that is causing headaches, of course. And that was my first inkling. I was like, either she's taking too many drugs altogether, or maybe one of these is causing the headaches. So we are going to, this week, try stopping the trazodone, and as soon as the migraines taper, then she will hopefully not need the phenergan, the topiramate, which she forgot to mention last time. She's also on topiramate, which is a daily pill for migraine prevention. And her nasal spray of the sumatriptan, she actually said she only gets 1 box per month, which there's 5 sprays in 1 box, or 5 bottles in 1 box. So she can only use that 5 times per month. So that one is already not a frequent medication. But as soon as her migraines go away, then she won't need her phenergan, which is as needed anyway, and then the topiramate will also no longer be needed. And of course, we will concur with her Western medical doctor to make sure that they approve these changes. Okay. And then what I'm hoping will happen are the migraines will calm down in a few days, and we can get her off all of those drugs, and then her pulses will just have a chance to come back to me, and maybe we'll make some more progress in other areas that I did not ask about, because not everything is going to improve in 1 week. Her needles, I changed her needles by, she didn't test for the ones in the lower abdomen, and I added the kidney meridian Tai Chi on the inside of the ankle. And then I also retested her herbs. So we still kept her Sendi and Shensen at the same dosages, and then this time, to help protect her stomach lining, I tested her, and she agreed, muscle testing wise, to 2.5 grams of Juru and 5 grams of Yutsu. Then for her overall cooling and hydration, and I need some circulation because I do think about the reproductive organs. I just can only do so many things at once. I started with one that I thought would get many birds with one stone, so I tested her for Guaiban and she said yes. So I started her at 5 grams, but that one I always put on the side because I'm not sure how many percentage, but a big enough percentage, enough of people have the allergic reaction of loose stools to force me to put it on the side. So she'll take a spoonful today, and if she doesn't have loose stools tomorrow, then she can continue adding it to her daily powdered herbs. And if she does have loose stools, I have so many military patients who are used to having to suck it up and take the pain or take the whatever torture and go with it. So I have to explain to these people and everybody in general, it is not okay if you have loose stools. If you have loose stools, you're having an allergic reaction, and we will take 2 steps backwards versus a step forward if you try to just suck it up. So please don't do that. I usually have that conversation with people just to make sure that they don't say, oh, it was loose, but I didn't go several times a day and it wasn't diarrhea, so I kept going. Because as I just mentioned, bowel movement is a tripod and the foundation of our health, and we need brown formed stools every day. No loose yellow stools are not normal. No pebbles are not normal. No, not going once every 5 days is normal. No, no, no. So and then we did cupping on her lower back again, and I am super excited. I wish this week could go really fast because I want to see her again and see how much progress she made and update you on her hopeful lack of migraines this next week. Okay, thank you so much for watching, and if you would like to be notified when I put the next video out about her, then please subscribe and turn on some notifications button. Thank you so much. Until next time, mahalo.